My name is Steven Tyler, and I have multiple sclerosis.
MS affects the ability of nerve cells in the brain and spinal cord to communicate with each other effectively. Nerve cells communicate by sending electrical signals down long fibers called axons, which are contained within an insulating substance called myelin. Evidence suggests that MS results from an autoimmune reaction in which a malfunctioning immune system produces T cells that react with and damage the body's own cells. In MS, an unknown trigger activates helper T cells. This enables the T cells to adhere to and cross over the blood-brain barrier, which normally prohibits the flow of substances into the brain. Antigen-specific receptors on the surface of T cells recognize central nervous system myelin as an antigen. The T cells attack the myelin that surrounds the axons. This causes the central nervous system to lose some of its ability to send signals throughout the body, causing the debilitating symptoms of MS.
Me personally, I have a case of what they call drop foot, and I wear a brace so my foot doesn't drag. Here, I'll show it to you. It's a cool little gadget that my daughter has decorated for me. Thanks, Emma. It's really cool because my leg drags, but there's a plate that goes underneath into my shoe that helps me lift my foot up so it's not being dragged. And like I said, what that problem is called, it's called drop foot, and it helps me with it. I know summer times are really rough for me because if I get too hot, I could barely hold myself up, and that's very scary for me.
And to talk about a disease like MS, which is really a medical mystery, we don't know the cause, there is no cure, and over 2 million people worldwide suffer from MS.
The type I have is relapsing and remitting.
4 different clinical subtypes of MS have been identified: relapsing remitting MS, secondary progressive MS, primary progressive MS, and progressive relapsing multiple sclerosis. Most people with MS present with relapsing remitting MS.
There are multiple medicines and diets that can help you out along the way and make things better. Science has come a long way.
Most people with MS will take a variety of medications over the course of their illness. There are 3 types of therapies used to treat MS: interventions to treat symptoms, drugs to treat acute attacks, and drugs that modify the course of the disease. Interventions to treat symptoms will vary immensely depending on the symptoms of the attack. Such symptoms may include fatigue, walking, tremor, bladder and bowel problems, pain, depression, erectile dysfunction, and spasticity. Interventions may be drug treatments, such as corticosteroids and disease-modifying agents, or interventions may be non-drug-based, such as physical therapy. Drugs used to treat acute attacks are believed to help shorten the length and severity of the attack. The most commonly used are intravenous corticosteroids. Adrenocorticotropic hormone, or ACTH, is another option to treat acute attacks. Corticosteroids are not considered long-term solutions. The reason why corticosteroids are for short-term use only is that they have no proven long-term efficacy, and because of the multiple side effects that can develop. Disease-modifying agents are drugs that you take on a regular basis to reduce the frequency of attacks. Some may also reduce their severity and slow progression to disability. Most doctors recommend starting on one of these medications as soon as possible following diagnosis of active, relapsing MS. They work by treating the inflammatory stage of MS. This helps reduce the formation of new lesions responsible for relapses.
I actually take Tysabri. It's a once-a-month infusion that actually doesn't give me any sort of side effects, which is a blessing. But the way my doctor related it was it's more for like kind of like cancer patients. They take chemotherapy, so it's a more intense drug. It does a lot of wonder for you, but he only is putting me on it for a couple of years, and then taking me off of it. It helps you out so you don't incur more attacks. And what an attack is basically a new lesion on your brain or spinal cord that gives you more problems, and it could be a variety of problems. I mean, for example, Jack Osborne, Meet the Osbournes, he actually has multiple sclerosis, and one of his symptoms at first was he went blind.
I got like a black spot in my eye, and then the next day I woke up and the black spot had turned into a black cigar shape, and then the next day I'd lost most of my center vision.
Osborne revealed on his mom's show, The Talk, that he had been unknowingly having symptoms for
How
years.
I found out I had MS, I was working for a cell phone company's call center at the time, and my balance, which has been in occurring onset of multiple sclerosis for me, was just really off. And one of my managers came up to me and said, "Hey, you should go see a doctor." I said, I'm good," because I was 25 at the time. Of course, I'm 25 and I'm invincible, right? And basically, she said, "You need to go see a doctor." I was like, "No, I'm good." She goes, "No, go home, see a doctor." So I saw a doctor, then I saw another doctor, and finally, through like a handful of different visits over the course of like a month, one of the doctors was like, "Let me call somebody." So he calls a neurologist, and the neurologist basically said, "Hey, send them down." And so I went down there, and they ran an MRI on me, and the sad part is I found out that I had MS via email, which was a little tough. Called my wife, bawling.
He called me while I was at work and told me, blubbering, he was already crying, and I mean, obviously we didn't know much about it, and the neurologist, like I said, was just an email, so we had no idea. The only thing he knew about MS was his grandma had it, and his grandma passed away. And from what I understand, she had other things as well, but I think that kind of stood out in his mind, and that's what he told me. So of course I freaked out. I left work, which was a 40-minute drive home, but the entire way home, I mean, I'm obviously thinking the worst, that I could lose him, that, if we don't have much longer. I mean, I don't know, there was just so many things going through my head. And I got home, and he's sitting there, he's crying, and then so we're both start crying, and until we finally stop and try to rationalize, okay, let's find out what this actually is.
One of the doctors I follow, Dr. Terry Walls, but she actually has progressive multiple sclerosis, which is worse than what I had, and she was stuck in a wheelchair, and she was used to biking and being active, but she was basically stuck wheelchair bound, and she decided to change her diet after seeing multiple other physicians, and through diet she is actually out of the wheelchair.
These are mitochondria. They're so beautiful, and they're so critical to your lives, because it is the tiny mitochondria in each of our cells that will manage the energy supply for that cell. Without your mitochondria, you would be no larger than bacteria. In medical school, I had to memorize countless reactions involving my mitochondria, but I never learned which compounds my cells could manufacture and which I needed to consume in order for those reactions to happen properly. I now know that I need a lot of B vitamins, sulfur, and antioxidants for my mitochondria to thrive. And so I added B vitamins, sulfur, and antioxidants to my daily regimen. And then it occurred to me that I should get my long list of nutrients from food. That if I did that, I would probably get hundreds, maybe thousands of other compounds that science had yet to name and identify, but would be helpful to my brain and my mitochondria.
I don't know, I've heard a lot of it's with leaky gut syndrome, where it's basically from your intestines and goes up to there's like a bacteria that goes up to your brain.
In this stealth disorder, sometimes called hyperpermeability, the lining of the intestine becomes damaged and allows bacteria, undigested food particles, and other material into your bloodstream. Since this material is not normally in your blood, your immune system attempts to fight it off as an invader. Some of the proteins that leak through into your blood resemble those that make up the myelin sheaths surrounding your nerve cells, and this causes your immune system to mistake your own myelin as a foreign substance. This autoimmunity can then damage your myelin and cause the symptoms of multiple sclerosis.
So one of the huge things, which isn't really medically proven, but one of the huge things that helps me is my family, and smiling, especially when I look at my daughter and my wife. They keep me strong, you know. You do things sometimes just because you know you need to support your family, even if you have a chronic illness like multiple sclerosis. You wake up every day and you try to fight. I wake up every morning and I pack my daughter's lunch and get her off to school, and my wife gets me to school and work, and I don't know. They keep me strong.
I mean, one of my biggest fears is not knowing what's going to happen in the future. And I know they say, you know, it's really from what I understand, I guess the worst it can get is bedridden or in a wheelchair where you can't walk at all, which is a whole nother thing. I obviously don't want that. But, I mean, I guess the one thing I try to look at is at least I still get to have him.
Not being able to walk my daughter down the aisle when she gets married. That's a huge fear of mine. I want to be there for my family. I really do. More times than not, they're there for me. You know, I wouldn't say unfortunately I have a good support system, but I just wish I could. I don't know. My daughter says that she wishes MS would disappear, and I agree with her.